This question's from Therese in Michigan. I spent almost 50 years working in the medical field, yet I just don't understand how GoodRx and other discount drug apps are able to give such significant savings on prescription medications. To answer this, it would help to know the basics on how drug companies value their medications and sell them to the pharmacies, etc. I've tried to research this myself only to give up. It's a head shaker. Do you have the answers?
Okay, so this is a pretty complicated situation, and it's behind the curtain. What you need to know is that the way prescription drugs are priced is where this really exposes how these apps are able to be of service to you. So when we're talking about brand name drugs, which account for a very small percent of prescriptions, you're not going to find GoodRx and their competitors to be of much applicability or help. Many times what we're comparing is a prescription plan that people have at work through what's known as a pharmacy benefits manager, and these big prescription buying organizations who buy from the manufacturers, and 80+% of prescriptions are generics, is what's happening behind the curtain is there's all kinds of dirty kickbacks going on where wink, wink, nod, nod, they get the prescription manufacturer to sell the drugs through the pharmacy benefits manager at a much higher price and then give kickbacks that should be illegal to the pharmacy benefits manager. And that's why people with a traditional prescription plan from work can end up paying much higher for a prescription than if they just went in and paid cash or used one of the apps like GoodRx or its competitors. So that's one part of it. Second part, traditional pharmacy chains like CVS and Walgreens have a system for pricing generics that has nothing to do with what they paid for them. That's why you can pay as much as 100 times the cost as CVS or Walgreens. If you just go in without insurance and you buy one, you can end up paying as much as 100 times more for a medicine than you would if you went to a discounter like one of the warehouse clubs or used one of the apps. Because what they do is they price theoretically based on a discount from the brand name that nobody writes or dispenses anymore. So the brand name drug may be a Zill, the generic may be pennies, but they're charging it based on a discount from the Zill that the brand name was. So that's the two major reasons why the price gaps are so enormous. If you are a Consumer Reports subscriber and you take a number of different drugs, they have a recent write-up showing, based on the drugs that you are taking, whether you will save money with this pharmacy or this one, and they rate different discount pharmacies and give you what your overall costs will be. If you take an enormous number of meds, there's even subscription services now where you pay a monthly fee, and then in turn, you get really amazing costs on drugs. And in those cases, you might find that the CVS or Walgreens retail price could be 500 times or more the cost of going through a monthly subscription program.